Rosedale's Neighborhood Association submitted a story for the Voices for Health Equity contest that I had last year, and I encourage people here to also collect digital stories and send them on to me so that I can post them, because I know more than learning from me, you are learning from each other. And so the mission of the Center for Health Equity is to champion champions. I tend to stay in the background so that I can really highlight the good work that you do to provide technical assistance to the Public Health Division at KDHE and to partners, so that we leverage the opportunities across the system to make change. And that's some of why you are here today, as you were last year, to understand with the launch of the State of African Americans in Kansas report what the opportunities are to really make meaningful change one step at a time. And how do you really find that focus and feel that you can be successful in a small step based on some choices you make from reading the State of African Americans in Kansas report, and find that you have a project, because we know in terms of chronic disease, lifestyle related, that 80% of total costs worldwide are through chronic diseases. That's an immense amount of funds. I would like to share with you a diagram that's very critical in the thinking that I do about the disparities trajectory. This is through the Prevention Institute out of Oakland, California. So please file that away, because I'm going to give you resources. My gathering basket is huge, and I'm going to offer some resources that you can think about also in terms of the work that you're going to do, because you want to get to work. You know the change that you hope to make. Sometimes there are additional tools that help to get us there. And so thinking about where we are with the last picture of 80% of costs in that last circle related to chronic disease, this diagram helps to set the context for understanding that so much of our funds go into medical care, right? Okay, that's a huge debate at the national level. It's really preoccupying a lot of us in terms of what are we doing to bring down healthcare costs. And so, as a person who's been in public health for decades, what I want to do is what Prevention Institute suggests, which is take 2 steps back. Step back to the largest circle, which is environment. Environment is where we have the conditions in which we live, learn, work, play, and pray. Those are the things that you see Rosedale Development Association addressing.